Your uterus is the home for your baby for 9 months, then actively pushes a baby out to be born. How much do you really know about this amazing organ? I'm Dr. Kamali, a board-certified OBGYN, and today we're continuing the series on your changing pregnant body. This is Preggy Pals.
Is that a plus sign?
Pink or blue? Hospital or home birth?
What type of food should I be eating?
I think I just peed myself. I'm pregnant, and I have to exercise.
What pregnancy glow?
Wait, was that a contraction?
Gotta make these pants fit. I've got kinkles.
What do you mean there's more than one?
You've got the symptoms, and now you've got the support you need for a happy 9 months. This is Preggy Pals, your pregnancy, your way.
Welcome to Preggy Pals, broadcasting from the Birth Education Center of San Diego. Preggy Pals is your weekly online on-the-go support group for expecting parents, or even if you're not pregnant but you want to be pregnant, go ahead and go to our website, www.preggypals.com, and learn up on all of our pregnancy topics, birth topics, anything that you want to know. I'm your host, Annie Laird. Thanks to all of our loyal listeners who have joined the Preggy Pals Club. Our members get special episodes. After each new show, there's bonus content you can listen to, plus special giveaways and discounts. See the website for more information. Another way for you to stay connected is by downloading our free Preggy Pals app. Now, thanks to a listener who chimed in on our website, it's also available on the Windows Marketplace. We've been saying for weeks and weeks and weeks that it's available on the Android and iTunes marketplaces, which it is, but it's also available on the Windows Marketplace. So whatever platform you're using for your phone, you can go ahead and download that. It's absolutely free. So when you're going around town, you're waiting at your OB's office for your appointment, or you're pushing your older toddler, or in Sunny's case, your 3 other kids or 4 other kids around in the multi-stroller, you can listen and catch up on all of our topics and all of our episodes. Now, Sam, our producer, she's going to be giving us some more information about our virtual panelist program.
Thanks, Annie. So if you don't live in San Diego, but you'd like to be a panelist on our show, you can still participate through our virtual panelist program. Just like us on Facebook and follow us on Twitter using hashtag PreggyPalsVP. And also now you can follow us on Instagram at New Mommy Media and check out the hashtag PreggyPals. We'll post questions throughout the week prior to our taping, and we'd love for you to comment so we can incorporate your thoughts into our episode. You can also submit your questions directly to our experts. Learn more about our VP program through the community section on our website, www.preggypals.com.
Great. Thanks, Sam. All right, well, let's go around the horn here and introduce ourselves. I'm Annie. I'm the host. I don't have a due date. I have 3 little girls, and they are 8 and almost 2 and 6 months old. So I am a busy mom. This is my break right now. So I'm having a great time. I'm like eating my lunch.
Like there's no kids around?
I have use of both my hands. I know. Like, what are these things? they're not holding children right now. So awesome.
I'm Samantha. I'm 22. I'm a mostly stay-at-home mom besides being a producer at Preggy Pals. I have one 18-month-old daughter named Olivia, and I currently don't have a due date, although I wish that I did. I had an unplanned cesarean with her, and I'm hoping for a VBAC next time around.
See, you always say, I wish I did, but then, they're going to go by, and our listeners are going to listen to these episodes on our website, a year from now and be like,
she's still not pregnant.
Wait, God, she's only 22. That's sure taking a long time.
I know, right?
Oh, hey everyone, I'm Sunny. I am the owner of New Mommy Media, which produces Preggy Pals, Parent Savers, The Boob Group, and Twin Talks. And I am joining as a panelist today because I love to talk about my uterus. It has been through a lot. I have 4 children at home.
You have a super uterus.
I have 2 boys and 2 girls. My oldest is almost 4. My middle guy just turned 2, and then I have identical twin girls who will be 6 months tomorrow.
I know.
Crazy.
It's funny because I see the pictures that you post on Facebook of your girls, and I still think of them because they don't come in the studio anymore because it's kind of hard.
Yeah.
When your kids are really little, it's easy to bring them in the studio here, and they were so little when they were. I mean, it's like under 10 pounds, which isn't really in my comprehension because my kids come out at 10 pounds. Right. But yeah, they're growing big. They're eating like crazy.
They are. They're doing really good.
And I love the little earrings that you put on them to tell them
got
different.
Their ears pierced, and it's nice because they're, like I said, they're identical, and even I was having a hard time telling them apart. And so it was nice because just a few weeks ago we got their ears pierced, and
so cute.
One has blue earrings now, the other has pink.
Perfect.
So now everybody can kind of tell them apart. It's like genius. So
yeah, because I'm not really big into ear piercing for little kids, but you know what? I think if I had identical twin girls,
easy.
Exactly.
No
I don't
brainer
know.
for me.
Yeah, exactly. I don't know how much my home birth midwife would be feeling about that. I'd be able to, like, really? Can we wait a couple? No.
No, right away.
No.
Out of the birth canal, snip.
Well, yeah, because you had the hospital band on for a while.
Yeah,
and you
then
said wasn't there a period of time where like the hospital band wasn't on anymore, and you were like, oh crap.
Well, first of all, those hospital bands, they're really hard, and
Yeah.
and just newborn, and they were preemies, and I just didn't want to keep the bands on them. So we started to do like ribbons, like different colored ribbons around their wrist, and I
thought
did that.
the ribbon fell off at one
Yeah,
point.
it did. I was changing the twins, and it fell off, and then I had 2 babies without any wristbands, and I went, oh my gosh. So for a few days, I really didn't know who was who until we got them in to see their pediatrician and weighed them, and one had always been just a little bit more than the other.
Yeah.
Now I can tell them apart, believe it or not. But my husband still has a hard time, and other people that don't.
There's
really
an
know 'em.
identical set of twins in my youngest daughter's daycare.
Oh,
And,
really?
Yeah, I can't tell the difference, but I guess she says one of their ears is a little bit different or something like that.
Yeah.
So it's like,
Moms always know that there's little nuances, but
Yeah.
still,
Yeah.
that's tough. That's tough.
all right, for our featured segment today, we're going to be talking about a news article that just came out just recently. The title of the article is Tennessee just became the first state that will jail pregnant women for their pregnancy outcomes. Which I think is a little interesting. I think pregnancy outcomes, oh, did you have a vaginal birth or did you have a cesarean birth? But that's not what they're talking about here. They're talking about that Tennessee became the first state in the nation that if you, as a pregnant woman, are taking drugs. Now, these are illegal drugs, illicit drugs. We're not talking about, something that your doctor prescribes you, that you as a pregnant woman can get charged with criminal assault if you use these illegal drugs during pregnancy and the fetus or the newborn is harmed as a result. So a lot of controversy about this. Is it okay to, and I guess it goes into, are you kind of with the mom here, that she's free to do what she wants to do? Or are you kind of with the baby or both? I mean, it's a really tough thing. One really affects the other. So, causing a lot of controversy, but American Medical Association, American Academy of Pediatrics, American College of Obstetrician and Gynecologists, other major medical associations, they're a little bit concerned. They're warning the Tennessee legislature that by criminalizing pregnant women, it's discouraging them from seeking prenatal care, which, maybe would help them get off these drugs or even getting off, drug treatment. So maybe they would be taking the drugs even longer because they know they're going to be criminalized. I mean, what do you guys think about this?
I think it's interesting that in a way, when you tell a woman, if an outcome is going to become the certain way after you deliver, I think it almost takes away a woman's autonomy because you do have the right to do with what you want with your own body. But again, you don't have the right to harm other people in that choice. Mm-hmm. So I think it's interesting. It kind of is a double-edged sword. It's tough.
Yeah.
It's a bit of a slippery slope also because then, would you say alcohol use during pregnancy is a criminal activity? Because in some ways, theoretically, you can harm the baby if you overconsume. Right. And then, and then you just basically go from there. But it already happens where, I covered a hospital every Monday for patients that are drop-in, meaning that they don't have any prenatal care and they just walk into the hospital. And, and we routinely do a urine drug screen on those patients, because they don't have any prenatal care and we just want to make sure we know as much about them as possible. And, I would say somewhere around 1 in 10 of those patients come back positive for methamphetamines or, marijuana or, other drugs. So it does happen that patients that, they have insurance, so it's not an insurance issue. It's just that they don't get prenatal care because they don't want to be told not to use or not to.
Right. Yeah, and I guess another thing that the article brings up is saying that only 2 in Tennessee, that there's 177 addiction treatment facilities, but only 2 of them allow the older children to stay with their mothers when they're undergoing treatment. So that really makes things hard. You're telling women, hey, you can, you won't be criminalized. Go and get the help you need. But if you got a 2-year-old, and dad is either not in the picture or he's working, then that really ties these mothers' hands. How do they get the treatment and the help they need? You're telling them on one hand you're going to go to jail, go get treatment, but there's not the facilities for them to go and realistically get that treatment.
I wonder how much they're intending on enforcing it, or is it just a threat to,
just a threat.
if you don't stop using this, you're going to go to jail. So, but I don't know.
Yeah.
It's interesting, though.
Mm-hmm. All right, today on Preggy Palace, we're continuing our series on your changing pregnant body. So if you remember, we did an episode, it was all about the placenta. So now today we're going to be focusing on the uterus. Joining us today as our expert is Dr. Kamali. He's a board-certified OBGYN. He mainly practices at Sharp Chula Vista Medical Center. Is that right, Dr. Kamali?
That's correct.
All right. And he just finished up last year as the chairman of the Department of Obstetrics and Gynecology. So spending more time with your kids. That's
Absolutely.
Great. That's awesome. Dr. Kamali, welcome to the show. Thanks for joining us today.
Thanks for having me.
All right. Well, to start off this interview, let's talk about, what is a uterus? Where is it in the body?
Uterus is located in a woman's pelvis. It consists of two parts. The top of it actually is shaped like a pear. The top of the uterus, or the fundus, basically is attached to the fallopian tubes and attached in proximity to the ovaries. The bottom of the pear, or the uterus, is basically the cervix, which is attached to the vagina.
All right, so it's in the woman's pelvis, and so what is the purpose of the uterus?
Okay, the purpose of the uterus is basically it's an incubator for the baby. So during from the time of conception, where the egg and the sperm meet in the fallopian tubes, they travel, and the actual pregnancy implants itself in the uterus, and through the ensuing 9 to 10 months, the pregnancy, the nourishment, the placental attachment to the uterus basically helps the growing baby develop.
So it's the baby's home, and then it's the delivery system as well. Yeah.
Like we say, womb service.
Womb service. Yeah. Let's get started. So today we're talking about the uterus. So when the pregnancy starts, how small is the uterus? Does it depend on the size of the woman?
Yes and no, but the best way to think about it is just actually the size of a woman's fist, so or the size of an orange, basically. So that's how it starts.
That's pretty small.
It is pretty small.
Wow.
Most of us, when we think about a uterus, we think about a gravid uterus or a pregnant uterus, which is a lot bigger.
Yeah, it's like the size of watermelon.
Absolutely.
Yeah.
But it starts off that small.
Yeah. No, if a woman gains too much weight, so what is the normal weight gain for like a regular pregnant woman, would you say?
About 20 to 25 pounds.
Okay. Do you see that often? I was like, I get
That was not me.
No, well, you had twins, honey. It's a little bit different.
That was not me with my singletons either.
In Europe.
Right. In Japan. Yeah.
There we go.
Yeah. So the pregnancy weight gain, does that have an effect of how big the uterus is going to be?
For most parts, no. I mean,
Okay.
the size of the baby, the uterus basically accommodates the pregnancy and the baby. So the pregnancy weight gain increase sometimes can affect the baby's weight, and then in turn that increases the size of the uterus. But it doesn't actually directly make the uterus bigger. It just, if the baby's bigger, then the uterus expands to accommodate the baby.
So does the uterus actually have cells that grow, or does it just get thick, it's really small and kind of thick, and then it just thins out? Is that how it works?
Exactly. Kind of
Okay.
like a balloon, if you think about just blowing up a balloon. So initially it's kind of small, but then when you blow it, it just kind of stretches out a little bit.
Yeah.
So,
Yeah. Oh, okay. Is the uterus, is it one muscle, or is it several muscles that work in conjunction with each other?
Yes and no. Both of those. It's a type of muscle called smooth muscle, which is a little bit different than our, for example, skeletal muscles.
Yeah,
in
like
the
your
biceps.
bicep or something.
Exactly.
Yeah. Okay.
So they're all basically a group of cells that are stacked on top of each other, and they work together. So they contract as one unit. So so it's a group of cells that are just kind of stacked on top of each other.
Now, with the smooth muscle, correct me if I'm wrong, that works involuntarily, basically.
Absolutely.
So, yeah, you don't have to think about having a contraction.
Exactly.
Although I'm sure, many of our listeners, that have had a baby before probably wish they could kind of will
Come
away
on
the
with it.
contraction.
Right.
So that is always kind of hard. So when you're giving birth of I just wish this contraction would go away. But unfortunately, that's what brings the baby. So.
Exactly.
Yeah. So Sam, how many hours were you in labor with Olivia?
I was in labor for 29 hours.
Yeah.
Although it was
Plenty of contractions then.
right.
Yeah.
Although it was medically induced, so there was many more steps to it, and much of it I did not feel. So
Yeah.
not as horrid as it may seem.
Yeah, because you had epidural, so
Right.
it sounds like your epidural worked well. So.
Yeah, it did.
Yeah. Yeah. Now, how does something like a drug like Pitocin that's used for a lot of women, they need to get augmented or induced. So how does the Pitocin, how does that affect the muscle of the uterus?
Okay. Well, Pitocin is a drug that's similar to a hormone that our own body produces, which is oxytocin. So, when time comes, and we really don't understand a lot about what brings on labor, but when that happens,
It's kind of odd, isn't it?
yeah.
Of like, here
With
we're in this
everything we know.
technological age, and all of a
Absolutely.
sudden the uterus starts contracting. We have no idea what the catalyst is.
Exactly. I mean,
Yeah.
we know that it's a communication between a baby's body and through the placenta and the mom's body. But yeah, we don't know a lot about all the biochemical markers. But in any case, our body produces oxytocin, and the Pitocin is similar to that oxytocin. It stimulates, the uterine contraction by stimulating electric signal that basically goes through those smooth muscles and makes them contract.
Oh, okay. Now, is the cervix, is that part of the uterus as well?
Absolutely. So
Okay.
the actual uterus is composed of two parts. It's actually the body of the uterus, or the uterine corpus, and then the cervix, which is again part of the uterus, and it's just basically a cylindrical shape part of the uterus, basically bottom part.
Oh, okay. We've talked on VBAC several times. So the last episode that we did on VBAC, I can't remember, it must have only been a couple of months ago, we touched a bit on uterine rupture.
Sure.
Now, so how common is something like that? How often have you seen that in your practice?
I've luckily only seen it once in the last 9 years, so that's good.
Yeah.
But part of that is also because VBAC is. Again, there's a pendulum that swings back and forth, and we're starting to see it a lot more. But VBAC was discouraged, and a lot of patients that they're concerned or scared about the possible poor outcome, so they shied away from VBAC, and also the convenience of C-section. Unfortunately, some of our patients just like the convenience of being able to schedule their repeat C-section, or they went through a difficult first pregnancy and ended up with a labor and the C-section, so they just wanted to go in and have a C-section and come
Be
home.
predictable, yeah.
Absolutely. So but again, like I said, the pendulum is swinging, and now we're doing a lot more VBAC.
It sounds like when you entered in practice, 9 years ago,
Yeah.
that it wasn't kind of a thing.
Right.
And yeah. So,
Absolutely.
yeah.
And then also in our community, because the hospital has a very strict criteria, and they're trying to, and that was partially dictated by some of the the ACOGs and all the different agencies. The hospital had strict criteria on what the physician had to do or where to be or what medication to use, and so a lot of physicians didn't offer that also. So that also was a little obstacle. But in any case, we've it's not that common, but the incidence in literature is about 1% of patients that attempt a TOLAC, which stands for trial of labor after C-section.
Okay.
1% of those patients end up with uterine rupture, and again, it also depends on the type of incision on the uterus itself. So, incision on the uterus is different than incision on the skin. So a patient can have a bikini cut on their skin, but on the uterus, they can have an up and down, what's called a vertical incision. And those have a significantly higher risk of uterine rupture, the uterus opening up. So that's somewhere about 4 to 9%, depending on which study you look at. So that's a lot higher. So if a patient has had a vertical incision, most of the time they're discouraged from trying a
TOLAC.
VBAC or TOLAC. Yes.
Yeah. Okay. Now, are most ruptures, are they catastrophic, or do most of them in the literature that it's like they try a vaginal birth or try a trial of labor, but it's not working? Okay, let's go in for the cesarean, and then there's a little bit of a
Right.
separation.
Well, so uterine rupture, by definition, is when all the layers of the uterus basically are disrupted or open up. So that includes, the uterus is made up of 3 layers: the muscle tissue, which we talked about, the lining of the uterus called the endometrium, and then there's a little thin layer called the serosa on top. If all those open up at the side of this scar, then that's called a uterine rupture. The baby, a lot of times, either some part of the baby's body, depending on how big the opening is, comes out, or actually the whole baby sometimes floats around in the abdomen. If that happens, which is complete uterine rupture, and the baby comes out, and sometimes the placenta separates, then that can be pretty dangerous both for mom and the baby, because the mom can start hemorrhaging, and then the baby doesn't get oxygen for that certain period of time. Luckily, when that happens, it usually happens in labor when a patient's already in hospital, And
I was going to say, how can you tell as an obstetrician what's going on with the uterus? Obviously, there's no x-ray machine saying, I think there's a rupture about to happen here.
Absolutely. Yeah. So if a patient does not have an epidural, it's accompanied by severe pain in the abdomen. But sometimes the epidural masks that, so we don't know that. But also during labor, patients are connected to the fetal heart monitor. So the baby's heart rate will drop, what's called bradycardia, or the baby's heart rate goes down. So that's one sign. Another sign is severe bleeding from below, because sometimes you see a lot of bleeding. And then another sign is that a baby's head that we used to be able to examine and was right there in the pelvis, or during a cervical exam, all of a sudden is no longer there. So we examine it.
Where'd he go?
Those are some of the signs. But you also have a low index of suspicion. So if any of those things happen, on a patient with VBAC, then you're quicker to kind of act.
Yeah.
But luckily, when it does happen, it happens in a hospital, and most hospitals have emergency C-section or emergency intervention drills set in place where, for example, at our hospital and most Sharps, but at Sharp Chula Vista, from a time that there's a deceleration, whether it has to do with VBAC or any other emergency, to the delivery, we get it done in less than 10 minutes. Basically, move the patient from their birthing room to the operating room, give them anesthesia, get their belly prepped, and then get the baby out within less than 10 minutes.
Yeah, and you'll probably be talking general anesthesia at this point, right?
Yes and no. For most parts, yes. Sometimes patients have really good working epidurals, so sometimes while they're getting prepped, they can get a quick dose. Exactly. Yeah. But most often, yes, general, because you're trying to get this done as quick as possible.
Okay. Yeah, great. Well, when we come back, we're going to be discussing more about the uterus, about actually what happens during the birth process with it. We'll be right back. Welcome back. Today we're talking about your changing pregnant body, and today focusing all about the uterus. So, Dr. Kamali, I saw some pictures from a friend's C-section recently, and the photographer was actually allowed in the OR. It was really kind of cool. I think it's up to the anesthesiologist really more than anything else. So, but anyway, so the doctor actually took the uterus out of the body.
Right.
So is that common?
So yeah, after the baby's born, a lot of times we take out the uterus out of the body just because it helps us repair or reapproximate the incision on the uterus a lot easier. And then while we're doing that, we actually look at the ovaries and kind of look inside just to make sure there's no other pathology. Mm-hmm. So it allows us to kind of do everything a little easier. It does sound a little weird.
Yeah, I was going to say, Sam, you said, oh, I didn't know they did that.
Yeah, I was not awake during my C-section, so in a small little bit of ignorance is bliss in this case. Other things I want to know 100%, but that I could do without.
And that's interesting because I forget what it's called. There's a term for it, but they're advocating having drapes that are transparent so the mom can see.
Like family-friendly cesarean.
There you go, exactly. Right. Yeah, so you can actually see the. And then some patients, really don't want to see because there's blood and fluid and all that stuff.
Yeah.
Instruments, moving around and stuff. So a lot of people don't want to see any of that, but some do. So.
I don't know. I think if it was me, I think, if I have a fourth pregnancy and it's determined that a C-section is needed, I don't know. I think I'd want I know I would want to see the baby born.
Definitely.
But then once I have my baby, then I'm thinking the opaque drapes would be awesome. Really, I don't want to see that.
Absolutely.
Yeah.
And, I usually just ask the person.
Can you have them lower the drapes?
Yeah. Well, what I do is they actually, the father or whoever's with the patient stands up, and if they want to film the baby actually coming out of the uterus and the first cry and all that stuff, they get to film that if they want or take pictures of it. And then I also just kind of put the baby over the drapes so the mom can see it.
That's heart-wrenching stuff. Sunday, you posted that video of your twins being born, and of course I was at work at my government computer watching this birth video. Oh no, no mind, I'll just put in my headphones, and I was bawling. Oh my gosh, that was just so beautiful.
Yeah. Well, so I've had 2 cesareans, and so technically speaking, my uterus has been out from my body twice. And
but with 3 babies.
What was interesting though is the first time I had a cesarean with my son, they had told me I started. They tell you, when you're having a C-section, if you feel any discomfort or you're nervous about anything, just let us know. Talk to us. And so there was someone up by my head as they were kind of stitching me up and stuff. And I said, I'm starting to feel it feels like pressure on my chest. And it was explained to me, and hopefully, Dr. Kamali, you can kind of shed some light on this. But if if the uterus is higher than your heart, something about the blood flow or something. I mean, it really felt like someone was sitting on my chest. And then they said, just bear with us. It's because your uterus is higher than your heart. And I'm thinking, oh my God, that means my uterus is out of my body. and here I am just having this casual conversation. But then once they fixed it up and everything, then the pain went away. But have you heard of that before?
Well, no, I think it probably had to do with not necessarily actually the location of it, but it's just that when we take out the uterus, especially if you had twins, uterus is a little bit chunkier. Yeah. So, and they took it out, and they're holding it. It was probably just kind of pushing right on your sternum or around that area.
Is it heavy? How much?
Well, that plus we're kind of pull it a little bit to give it a little traction so that we can suture it, and then so the assistant's hands are probably there holding it too, so that also altogether could just kind of put a little bit of pressure on your chest. So we hear that commonly, that patients feel a little pressure on their chest when they do that. Yeah.
I didn't have it with the girls. I just had it. I had it with my first C-section. I was waiting for that pressure because it was very uncomfortable. Yeah. So I was waiting for that, and I didn't get it at all with the girls. So.
Lucky you.
I know, right?
Yeah.
And sometimes we don't take out the uterus. I mean, depending on what the environment looks like, sometimes we just suture right inside the abdomen. So it sort of depends on the physician also. Yeah.
So after the baby's born, then you have Lochia for hopefully a week, but usually I had Lochia for Lochia.
Wait, what is Lochia?
Yeah,
Lochia is the endometrial layer basically after the pregnancy. Endometrium is actually the lining of the uterus. Okay. So let's start with that. And during pregnancy, the lining of the uterus basically has become thicker to be able to support the pregnancy and attach to the placenta. So once the placenta is delivered, all that extra lining, your uterus basically tries to let all that to shed all that extra lining. And slowly that fluid and the extra blood and the cells are shed, and that usually happens the first 24 to 48 hours. There's different types of lochia. There's lochia rubra, which is red and red-brown, kind of wine-colored, and that's the first 24 to 48 hours. After that, it becomes a little bit kind of lighter or whitish, and then it becomes kind of watery. So over the next 4 to 6 weeks, you will have some sort of a lochia, but the red and wine color red is the first 48 hours.
Oh, okay.
Yeah.
So it sounds like the first 48 hours, that's the lining of the uterus.
That's
then
right.
And after that, is it kind of the placenta wound kind of healing up, or is it still the lining of the uterus?
It's the lining of the uterus, but the bleeding itself sometimes is from those little vessels that were connecting the uterus to your to the placenta. Mm-hmm. And when the placenta detaches, all those little blood vessels are all of a sudden just kind of detached, and your body's coagulation system tries to stop the bleeding and close up those vessels, and also the contraction of the uterus also helps with that. So some of the bleeding is from those little vessels while they're trying to heal up and close up. You will have some bleeding. Okay. And then it depends on when you stop breastfeeding, or if you're planning on breastfeeding, hopefully you are. Then that also helps with the bleeding.
Well, let's talk about that. So after the birth, and this was my second birth, the nurse pressed on something fierce, like on the top of my uterus, and it hurt a lot.
Absolutely.
So, why was she doing that? Is that something common, like a common standard of practice that they do that,
Sure.
like pummel on your abdomen like Rocky, you're just like...
Well, usually we try to do no harm, so we try not to hurt you, but no, what it is they're checking to see if your uterus is contracting. And so we talked about the uterus being as big as a watermelon towards the end of the pregnancy.
Oh, so it doesn't stay like that.
It doesn't stay. No. Yeah. So as soon as the baby comes out, then all of a sudden those little smooth muscles that we're talking about, all of a sudden they start contracting, and the uterus start the process of involution, which is when it tries to shrink back to the regular size of your fist or the orange size. So it starts right after the birth of the child, and when those muscles start contracting, the uterus will become very firm, as hard as a rock, and it's even harder than when your uterus was contracting. And the purpose of that is basically, as we talked about, those little blood vessels. Once the placenta detaches, those blood vessels need to contract and close down, or else you're going to be bleeding. So that contraction is very important. So the nurse is basically checking to make sure your uterus is contracting adequately, and also sometimes your uterus accumulates some clots inside, and when they press on it, those clots come out. So sometimes it's hidden, so you don't know the patient's bleeding. But when you push on it, all the clots come out, then you know the patient's bleeding.
You don't want that hanging around in your uterus. Yeah,
right.
Yeah. Now, Sam, I think we had a question online about this, didn't we? Something related to this?
Yes, so Stacy was asking, so I'd be interested to know how it changes after pregnancy too. How long does it take to go back down to regular size? Does it ever go back 100%? Or are there things about it that change after carrying a baby?
Sure. So it takes up to about 6 weeks for it to completely go back to normal size. By immediately after birth, the uterus is around the area of the umbilicus, so it shrinks down significantly right away. And then
so basically by your belly button.
Belly button, exactly.
Yeah, okay.
Right. And then within about 48 to 72 hours, and sometimes as long as a week, it's halfway, between your belly button and the pubic bone, the line there. And then by about 4 weeks, it's in your pelvis again, and then it just shrinks down by 6 weeks down. Does it ever go back 100% to the same size? Probably not, but we don't really understand much about all that stuff. Why the women's shoe size change, with different pregnancy. Why does the uterus not? But the thinking is when it those muscles stretch, sometimes they don't 100% go back to the exact same size, but they get pretty close to the size it was before the pregnancy.
Oh, okay.
Yeah.
Well, thanks, Dr. Kamali, for joining us today.
Absolutely.
For more information about Dr. Kamali and his practice, as well as information about any of us on the panel today, visit the episode page on our website. This conversation continues for members of our Preggy Pals Club. After the show, our expert will be discussing bicornuate uteruses and what that means for your pregnancy if you have one. To join our club, visit our website, www.preggypals.com. Got a pregnancy oops story, funny story here from Jessica from New York. She writes, I caught my husband trying on my belly band. He said he was going to get a watermelon and strap it to himself for a little while to experience a fraction of what I'm going through. I told him I would purposely give him food poisoning to feel morning sickness, as well as kick him in the genitals to make it feel more real if he wanted. He didn't. He gets a good hubby award for trying to see what it felt like, though, and I didn't ask him to. Love that guy. If you got your own pregnancy oops, you can share it on our Facebook page or call our voicemail at 619-866-4775. That wraps up our show for today. We appreciate you listening to Preggy Pals. Don't forget to check out our sister shows, Parent Savers, for parents with newborns, infants, and toddlers, Twin Talks for parents of multiples, and our show, The Boob Group, for moms who breastfeed their babies. Next week, we'll be continuing our series on hiring your care provider. What is a postpartum doula, and how do you go about interviewing one? This is Preggy Pals, your pregnancy, your way.
This has been a New Mommy Media production. The information and material contained in this episode are presented for educational purposes only. Statements and opinions expressed in this episode are not necessarily those of New Mommy Media and should not be considered facts. While such information and materials are believed to be accurate, it is not intended to replace or substitute for professional medical advice or care, and should not be used for diagnosing or treating healthcare problem or disease or prescribing any medication. If you have questions or concerns regarding your physical or mental health or the health of your baby, please seek assistance from a qualified healthcare provider.
New Mommy Media is expanding our lineup of shows for new and expecting parents. If you have an idea for a new series, or if you're a business or organization interested in joining our network of shows through a co-branded podcast, visit newmommymedia.com. Hey mamas, don't forget to check out Mighty Moms. It's our online community built for new moms just like you. Not only can you connect with other moms, but you can also join us backstage for special mom-only online events. And you'll also be notified when we're recording so you can join us as a special guest. Visit our website, newmommymedia.com, and click on the Mighty Moms banner. It's free. That's newmommymedia.com. See you there.